Well, hello everyone, and welcome to the Community Caregiving Initiative Technical Assistance Workshop. I'm Feline Wiggins, the Director of the Santa Barbara Foundation's Community Caregiving Initiative. And our objective today is to share information with you about what we're planning to do with our 2018 Community Caregiving Initiative grants. These grants are formerly known as Family Caregiver System and Support Grants, and I want to make that connection so that there's no confusion. Many of us, for those of you that are new, you will probably wonder about the CCI, what we call our Community Caregiving Initiative shorthand, and our vision for what we're hoping to achieve. Really, we're looking at how we create a strong, resilient community that prioritizes caregiving and ensures the safety and security of our aging population as well as those who care for them. This is a county-wide initiative to strengthen individual caregivers and create a community network that supports caregiving. You might be wondering why we're doing this and why the Community Caregiving Initiative is important to the Santa Barbara Foundation. Well, AARP came out a few years ago with a really important statistic that over 80% of the long-term care in the United States is provided by unpaid family caregivers. These are those folks, all of us, that care for those we love at home. The types of support that we provide them could range from preparing meals and transportation to doing complex medical procedures. There are many ways that caregivers support people who are living at home with a disability or frailty or disease. In Santa Barbara County, the caregiver population is not doing very well, and the types of things that we have learned as we've gotten engaged with this work is that caregivers in Santa Barbara County experience diminished health outcomes. They have high blood pressure, asthma, they delay their own medical care, they are in poor health, they don't get their prescriptions filled. And this is really challenging for a population that we're depending on to provide the kind of care that our loved ones and our community members will need in the years ahead. In addition, family caregivers experience serious psychological stress. For example, they are 2 times as likely to have seriously considered suicide in the past year. This is a very high level of stress that we need to understand and find ways to address. They also experience moderate to severe impairment in their social life. There is more information on the needs of caregivers, and the Foundation will be publishing a profile on family caregivers in the coming months that we hope will really paint a picture of the realities of what it means to be a caregiver in Santa Barbara County. So, what is the Community Caregiving Initiative doing? The initiative itself has 4 areas of focus. One being individuals, and this is really how do we address individual caregiver needs? We want to work to increase their knowledge and ability to care. We want to see them be able to self-identify, and we want them to be aware and appreciate the very important role that they serve for their loved ones and for our community as a whole. Another area of the initiative is to support coordinated efforts, systems if you will, to streamline access and really make caring the easy option for caregivers. Coordinating care and finding support can be challenging for individual caregivers, and our systems aren't designed to include the family caregiver as part of the long-term solution. And so as a result, the caregiver suffers. As I noted before, the health outcomes for caregivers are really quite staggering. The initiative wants to see organizations communicating and collaborating, making cross-referrals, and integrating caregivers into the care system, helping to improve their ability to navigate and get the care and support that they need and the care and support that their loved ones need. The initiative is also supporting research, and one of the important projects that we have funded more recently is to work with the Atlas of Caregiving. This group has really helped us to accelerate our work here in the community and provided new windows into caregiving through their deep research into the lived experience of caregivers. One of the ways that we have found to be really critical in helping us to see the particular circumstances of caregiving is through the use of care maps. And that helps us to find new knowledge, and that will help us to look at our community in a much more holistic way based on the individual supports or lack thereof the caregivers themselves are discovering that they have. We will share more about care maps later on in this webinar. The last area that we're looking at is how do we educate a broader audience and inform public policy with the work that we're doing. So the Community Caregiving Initiative now has a relationship with the National Office of the AARP. AARP is looking at Santa Barbara to learn how to create community momentum and change that will support caregivers. They want to use the work that's being done here in our community to educate communities across the county about the importance of caregiving. And they want to use what we're learning here to help inform their public policy efforts. We're very excited about this partnership, and it offers an opportunity for organizations that are working with the Community Caregiving Initiative to really have their voice elevated to a national level, and the learning and experience that we gain here would be offered much more broadly to share with organizations and communities across the country that are also looking to how they address the increasing need for care. So with that in mind, the foundation will be providing grants, the community caregiving grants for next year, and really the focus of these grants is on the individuals and systems aspects of the initiative. Our grants are 1 year in length, and we also want you to think bigger. We'd like to have you project out your current thoughts for your project 2 and 3 years out. We understand that this is very groundbreaking work, and so we'd like to hear your ideas now for the future, but we also understand that things can change as we learn more and we find better ways of working together or better ways of addressing the kinds of challenges that we're focused on here. Awards will be up to $75,000 depending on the project. So eligible organizations are those that are serving Santa Barbara County residents. We are looking for groups that have a 501c3 status or may use a fiscal sponsor. For some of the work, it will be a collaborative project, and we would be looking for a lead organization that has 501c3 status to be the responsible entity for a collaborative project. So the funds may be used for new projects. It could be used on projects that are building on work that's already in progress. We have supported caregiver grants for the last several years, and some of that work is bearing real fruit, and those projects are also eligible to come for funding. It could also build on work that is already being done to address caregiver needs, and we'll talk about the kinds of work that we hope to see in the next few slides. So expenses such as direct or indirect costs that are clearly tied to the outcome of the project are eligible for funding, as well as coordination of efforts and the evaluation of results. Funds, we don't want funds to be used for ongoing and existing programs. We know that there are excellent programs going on out there. We're looking for how those programs can be brought into alignment with other efforts that are going on in the community. So we're not looking at supporting those projects ongoingly, but actually we're looking to see them aligned differently so that we can achieve some different outcomes. Also, funds should not be used for general operating support. This is not the kind of grant program where we would be paying for a roof or paying for your rent or things like that. So this is specific funding directed towards outcomes for in the caregiver space. So there are two types of projects that would be eligible for support under this grants program. First are regional approaches that are community-based. And the second approach is capacity building, which really identifies gaps and addresses gaps in service. We anticipate that both approaches would support individual caregivers and that both approaches may support a systems change or sort of, as I said earlier, realignment of how we work together to enhance outcomes for caregivers. So let's look at these approaches a little more in depth. First, the regional approach. The regional approach is a focus on a specific geographic region, and it really represents a community change effort. Something that is innovative, that really looks at caregivers differently and helps to change the way that the community addresses the issue of caregiving. A regional approach generally includes 3 or more groups that are working together. And applicants should demonstrate capacity for the work as well as a track record for results. So what we're looking for there is if the lead organization should have experience in collaborations and be recognized as a leader in its particular area. In addition, if there is the maximum award is up to $75,000, and I would like to just share a couple of examples briefly. We have been funding some work around this with regards to in Lompoc. The Lompoc Valley Community Healthcare Organization has been doing a community-wide, really bringing together the social service providers, the healthcare groups, some of the businesses, their city, and community-wide resources to address social isolation for caregivers, and they have initiated and provide resources for caregivers. So a new caregiver support network hub has been launched. Outreach is being conducted to the Latino community, physicians' offices, and employers to make them aware of the services available for caregivers in the community. Marion Regional Medical Center is another example. They're working to embed and support caregivers in the healthcare system as a critical partner and seeing caregivers as a critical partner in their care team. They're partnering with a variety of community-based social service organizations to support caregivers once their family member is discharged from the hospital and returns home. So those are the kind of projects that we're currently funding under the regional approach. Another approach is the capacity building approach, and this is really to focus on identified gaps. And I think there's a lot of commonality between a regional approach and also a capacity building approach, although the capacity building approach might be more focused on, say, an individual organization. But we're looking for identified opportunities, identifying gaps in support, and addressing specific opportunities to come into that space. Applicants need to demonstrate a capacity for the work and a track record for results. So the awards for this area are up to $75,000 for collaborative projects, again, 3 or more partners, and up to $40,000 for individual organizations. Some examples of this kind of project include our Promotor Network, which has expanded its focus to include caregivers, or focus on caregivers, and how they have been educating their caregivers on the issue, or their members, their promotors, on the issue of caregiving. The Alzheimer's Association has been working with them to provide disease education on Alzheimer's and dementia to the Latino community through the Promotor Network. And this was an identified gap where the Latino community had largely not been engaged around the issue of caregiving. And so these capacity building efforts have really helped to build new strength in our community to include the Latino community members. Another example is the Family Service Agency that's been working with Antioch University and the Alzheimer's Association to educate and develop new therapists who can provide mental health care for family caregivers. These newer therapists are learning about the issues related to family caregiving, something that had been not as prominent in their training. They're also getting more information about how Alzheimer's impacts family dynamics. And so this group is looking for new partners to join and have supervised placements, as well as to look at how to enhance the capacity of the existing therapy workforce to address caregiving. And as I mentioned before, caregivers have significant mental health challenges, and so building the capacity of those providers to support that is a really important capacity building strategy. Lastly, Cottage Hospital identified a real opportunity for them to navigate caregivers through the system, which is very, very challenging. Healthcare has so many details and ways where caregivers can make a difference for patients, and Cottage identified an opportunity for navigation in regards to these kind of services. So there's a variety of opportunities that are going on in the capacity building area, and your organization may have identified some new ones that aren't currently being addressed. So let's look at projects and where we go from here. So projects must be either currently funded and in progress or ready to launch by January 2018. We're looking for using data, which could include the perspective of family caregivers, or perhaps the profile that I mentioned earlier of family caregivers. That has not yet been published, but I'm very happy to share the information with you that we have thus far. We also want to see articulated outcomes for the caregivers as a result of the project. So it's very important that an evaluation or measurement component be incorporated. Really, that question is, how will you know that something is different for the caregiver as a result of your work? That's the question that needs to be answered. You may want to consider burden or depression scales. Hospitals have been looking at their readmission rates when a supported caregiver is involved. There are a variety of ways that this can be, that we can incorporate evaluation. And then speaking of evaluation and learning, something that is very important to this work is that there is a larger framework for evaluation, and that is how are our caregivers doing in our community. And so for organizations that would be receiving funding through this, we want to see a commitment to collaborative data sharing. You might wonder what this actually means. Well, as I mentioned earlier, AARP is very interested in our work, and if your organization is selected, your project will literally be able to have an opportunity to write the book on how to support caregivers in the community. So, so these evaluation efforts could include a caregiver survey, an organization survey, an interview, convenings perhaps, as well as the possibility of piloting new tools and certainly learning from the work that is going on. So in return, the foundation shares opportunities for you to showcase your work, such as conferences and other convenings. So we look at this as kind of a mutual opportunity for us to help showcase your work and for you to help us as a community learn together. We are looking at how to incorporate the use of the Atlas of Caregiving's CareMap, and we want to, projects should look at this tool, and we'd like to broaden the use of the tool so that we can learn even more about our community. And CareMaps include clearly, they're drawn by caregivers. They include information that caregivers identify themselves. Some of you may not be familiar with the Atlas of Caregiving. We do have some current grantees that are partnered with that group. They include the Marion Regional Medical Center, the Family Service Agency, the Promotor Network, the Lompoc Valley Medical Center, and some other groups may have attended, perhaps someone from your organization attended a CareMap in the past year and a half. Rajiv Mehta is the director of the Atlas of Caregiving. Again, he helped to facilitate the workshops last year, and it has been very deeply involved in these local partnerships. And if you'd like to learn more about what a CareMap is, there is some information online. There are several YouTube videos that can help you understand what a CareMap is, how to draw one, and how to use one. And in addition, we are offering a CareMap workshop on September 19th in Santa Barbara. We'd like to make sure that we have the right people there. This would be run by Rajiv. So if you are interested in attending that, we ask that you contact Madison Martin by September the 11th to let her know of your interest, and then we will share more information with you. So CareMap training will be available, and we hope that if you're not familiar with this tool, that you will join us, or at least review what's online and what's currently available. And then think about how you would incorporate that into your work. Okay, now on to the logistics for submitting your application. So the way to do this is you go to our website, ccinitiative.org, download the application. You'll want to use the Save As feature to save your application to your computer. And then there are very specific word counts for each question. Be sure to use only the space allotted. If you go beyond that, it will result in unreadable text, and you don't want that. Use the text that is there. So, okay, then your application packet, it should include your grant application. It also includes a board of directors roster, your project budget, the organization financial summary and organization balance sheet, as well as a copy of the 990 and 990 EZ and the most recent audit. The last items would be, this would be for the organization that would be the lead applicant organization. If you're part of a collaborative and you are not the lead organization, you do not have to submit these pieces. This is only for the lead organization of the collaborative. Now, with that said, if you are involved in a collaborative project, there are a couple of additional requirements. There should be a roster of the partners included in your application and an agreement that's signed by each partner organization that outlines the roles and responsibilities for the project. So we want to make sure that you know what you're committing to, that there's agreement among the partners of the collaborative project as to the respective roles that each will play. So, application submittal. This is done electronically via email. You just simply attach the file to your email. In the subject line, you'll want to include the name of your organization and then CCI grant application in the subject line. I'm giving you an example here, just Family Service Agency, CCI grant application, and then you'll email that to grants@santabarbarafoundation.org. Our deadline, I believe, is October 2nd. So here are some important dates that you'll want to be sure to put on your calendar. So first, if you're interested in CareMap Workshop, contact Madison Martin by September 11th. If you are going to be attending the CareMap Workshop, be sure to mark September 19th on your calendar, and we'll get you some the times on that. And then your application deadline is Monday, October 2nd. We anticipate the funds will be awarded in January of 2018. So here is some important contact information for you. We want to make sure that you have the connections to the right people. So if we are strongly encouraging a conversation if you are considering submitting an application. So if that's the case, I would ask you to speak with me about proposal content. If you need assistance with the technicalities of submitting the application, please contact Sadie Terry at the foundation, and her information is there. So if you're having trouble downloading or something like that, Sadie's your person to go to. Lastly, if you are interested in attending the CareMap Workshop on September 19th, we do ask you to reach out to Madison Martin and let her know of that interest so we can log that and be sure that you receive appropriate follow-up information. And with that, I think we're ready to conclude, and we do appreciate your interest in the Community Caregiving Initiative and in the grant opportunities that we have in the days ahead. So thank you all. Again, please contact me if you have any questions.